Hello, my name is Ivy. I'm a fourth-year social work student at Toronto Metropolitan University. I'm currently completing my placement with the Organization for a Safer Space. Today, I'll be talking about major depressive disorder. In this video, we'll first discuss what major depressive disorder is. We'll then look at some statistics, risk factors, signs and symptoms, effects, treatment, and lastly, we'll look at some coping strategies. In 2008, the World Health Organization labeled major depressive disorder as the third most burdensome disease worldwide, and they predict that this disease will rank first by 2030. The Diagnostic and Statistical Manual of Mental Disorders 5 characterizes major depressive disorder by two primary diagnostic criteria: depressed mood and loss of pleasure or interest in activities. At least one of these must take place for at least 2 weeks. Major depressive disorder interferes with everyday life, affects one's ability to eat, sleep, and work. According to the DSM-5, the other types of depression that fall under depressive disorders include disruptive mood dysregulation disorder, premenstrual dysphoric disorder, persistent depressive disorder, substance medication-induced depressive disorder due to another medical condition, and unspecified depressive disorder. Statistics: approximately 322 million people around the world have depressive disorders. Major depressive disorder has an average lifetime prevalence of 12%. The prevalence rate for women is almost double the rate for men. This is due to the differences in hormones, childbirth effects, and differing psychosocial stressors. The age of onset is generally in the early 20s due to alcohol and drug use. However, the average age of onset is around 40 years old. Major depressive disorder is estimated to be 35% heritable. Risk factors: major depressive disorder is said to be multifactorial, with biological, genetic, psychosocial, and environmental factors. Some factors include genetic or family history of depression, psychological or emotional vulnerability to depression, an imbalance in brain chemistry, major life changes, stress, trauma, isolation, or lack of support, certain illnesses such as cancer, diabetes, or Parkinson's disease, and medication. Signs and symptoms: people with major depressive disorder can have comorbid disorders, including panic disorder, social anxiety disorder, substance use disorder, and obsessive-compulsive disorder. Symptoms of major depressive disorder include depressed or irritable mood. Depressed mood must last for more than 2 weeks. A loss of pleasure or interest in things. Significant changes in weight. Insomnia. A decrease or increase in appetite. Agitation, fatigue or low energy, feelings of worthlessness, excessive guilt, low concentration, indecisiveness, social withdrawal, and suicidal ideation. Effects: major depressive disorder is a chronic illness. The recurrence rate is about 50% after the first episode, 70% after the second, and 90% after the third. If left untreated, major depressive episodes in major depressive disorder can last from 6 to 12 months. For people with this disorder, the presence of comorbid disorders can increase the risk of suicide. Approximately 2/3 of people with major depressive disorder experience suicidal ideation, while 10 to 15% commit suicide. Around 5 to 10% of people with major depressive disorder develop bipolar disorder. People with this disorder also have a higher risk of developing comorbid anxiety disorders and substance use disorders. Major depressive disorder can exacerbate other comorbidities such as diabetes, hypertension, and coronary artery disease. Lastly, major depressive disorder can significantly impact one's interpersonal relationships and consequently lower the quality of one's life. Treatment: due to the stigma around mental health conditions, people can be hesitant to discuss and seek treatment for major depressive disorder. Thus, psychoeducation is imperative to help one better understand their condition, improve patient compliance, and medical adherence. Major depressive disorder can be treated with different modalities, such as pharmacological, interventional, psychotherapeutic, and lifestyle changes. Initial treatment includes medication or psychotherapy. However, a combination of these two has been found to be more effective. Psychotherapy can include cognitive behavioral therapy and interpersonal therapy. These types of therapies helps to change one's distorted views of themselves and their circumstances, identify and manage stressors, and improve relationships. The most effective treatment for major depressive disorder is electroconvulsive therapy. This treatment is used in severe cases and when a person does not respond to medication. With this treatment, a mild electrical current passes through the brain to restore the chemical imbalance and relieve symptoms. Coping strategies. Evidence supports that lifestyle changes can help to improve major depressive disorder. These include getting regular exercise, eating healthy, well-balanced meals, improving sleep hygiene, avoiding substance use, using stress management strategies, and engaging in pleasurable activities regularly. Other ways to cope with major depressive disorder are to set realistic goals, break large tasks into smaller ones and do what one can, think positively, and talk with family members or friends. Involving one's family can improve the outcome of the treatment. If you have any of the symptoms described in this video, it is important to seek help. Feel free to check out the organization For a Safer Space at forasaferspace.org, where you can have access to accessible, affordable, and affirming mental health care with licensed mental health professionals. Thank you for watching and have a great day.